Good morning. I'm Savitran, and I'll be the host and the speaker for today. First things first, I would like to thank Eddie and Taha for giving me this opportunity and the uh, warm welcoming into the team and the opportunity to host podcast. Um, I think all the viewers who have been viewing our content from the day one, or who have been following us since the past few videos, a big shout out to all of you. Thank you because you guys have motivated us in many ways by viewing the content. All of us, I think, have many a times chosen podcast over our leisure, podcast over our hobbies, and many a times left few things. It could be housework, it could be anything of that sort for meeting the deadlines and to post and upload the videos on time for you every week. So I think the discipline which is there in the team, in each member of the team, is something to be appreciated. And I really think Eddie and Taha are doing a great job. And today I just wanted to take a few minutes for them and thank them at the same time. Thank all the viewers, all of you who have been viewing our content so far. And I really hope that you are liking it. I would strongly suggest you to put up in the comments if you would prefer any topic to be spoken about, um, or anything which you would like to view or listen to, because we are here to make and create the content on the topics you like, on the things you prefer hearing and listening. At the same time, our knowledge on those topics also would improve by you know looking up on those information or speaking to such people, contacting people who could be our guest uh, pertaining to the certain topics. So we would be most, I think, happy and welcoming such genuine comments and feedback. Coming to our topic for today, we will be speaking about, since it's just me today, I would like to speak on a very common topic which all of us have faced at some point, some of us are going to face, and some of us have been facing, and we are still dealing with such issues on a daily basis. So, what it is really, uh, every med student faces certain set of issues after coming into an MBBS program or a BDS program or a BBMS program or a PharmD, B Pharma, any program, any medical med school course. Once a student gets into it, faces certain issues. We are going to talk about those issues, and we're going to talk about how exactly can one really face it, really find a solution to it. Because hiding from problems, running from problems could never be the real solution. Even solution of the problems is not always possible, because some problems never have a solution to it. They have to just be faced and tackled in the right way. So we are going to today focus on certain problems which are recurring problems which we keep facing. And in fact, those are not problems, those are some challenges which every single person has to face, some hurdles which every single person has to face to meet their goals, to meet their expectations, to exceed their expectations. So we are gonna speak about that today, right? So moving on to the first main complaint of most of the students. First things which every med student has would hands down say, this is, yes, this is a real problem in med school, is the heavy workload and managing time. Most of the students have been telling that balancing lectures, clinical rotations, and the study and their personal study time. Most of the students self study Few of them do have the combined study, which they blend with like few other students. It could be same course, it could be different course, or it could be some friends, bunch of friends. It could be through online Zoom Meet, Google Meet, but they usually find a hard time uh, sitting down and finishing up studying their portions. So the best way to deal with this is, first thing is never, I would say, never really be overwhelmed about such situations. Never really be frustrated out of it. And I think the first thing to realize is keep your calm, because once we lose our calm, once we start panicking about the whole scenario, or once we, there's a lot of scope for or room for misjudgment. We might think it's a lot. We might exaggerate the real situation. So I think one of the main things to do one of the main things to do when there is an overwhelming situation is to keep your calm, and to break things down. The first things which has to be done is to break things down into smaller chunks, because every time there is an overwhelming situation, which it means that you can't consume the whole thing at once. You have to break it down. You have to plan it accordingly, and then focus on the single tasks which you have set for yourself. So in the next 1 hour, I'll be doing this. In the next 1 hour, I'll be doing this, and then I'll take a half an hour break, and then I would continue doing this. I think that's a good strategy and good way to go forward. Whenever there's a overwhelming situation, the first things to really focus is that. After which you can prioritize your tasks. That comes secondary, where you once you've broken down the task, then you can accordingly choose. Okay, this exam is going to come first, or this thing is going to be there first. So I'll finish this up, and then I'll go to the next one. And of course, time management techniques like Pomodoro is a great technique, which personally I have used when I get a long break and I have to get back to my routine after a long break. For example, it could be a long weekend without exams, because usually when there's an exam after a long weekend, we tend to be in great stress and we prepare for it. But when there's no exam and we get a long weekend, it's usually very relaxed and chill. Once you get back to med school, after that it becomes a little like tough for us to get on the routine, and especially if we have an exam in the same week after the break, it's really hard to cope. So for such situations, or for say like vacations, long vacations, summer vacations, when we go back home, or when we travel, after traveling, after saying we lose touch from our daily routine which we have been having, the set routine, it breaks out. So when getting back in the routine, getting back on track, it's a hard process. So we need to I think use such techniques to get back on track, and once we are on track, it gets easier, things eases out. So I think Pomodoro technique is one good technique which I have used. And the another one which personally I have used is the using play cards, like using play cards, writing down some important points of information from a certain topic, and keeping it, like sticking it up on the wall, putting it up on the fridge, like using magnets or something, putting it up on the fridge, putting it up on the walls, so that whenever I go anywhere I see, I am able to continuously look at, okay, these things, okay, that there'll be a pathology stuff put up on the wall, there'll be something put up on the fridge, some points to remember. So I think these kind of things will keep reminding us that, okay, we gotta it triggers our memory onto what we have learned. So it helps me to recall all the things which I've learned. And so Pomodoro with the play cards which I use, I think it really works for me. You can find out more techniques on the same, um and use these if it works, or use the ones which work for you the best. Another thing about the how to manage heavy workload, or you know how to manage your time, would be to create a focus group with your among your peers or your mentors, or however it works for you. uh, a group where you feel like sharing all your things without having the feeling that you might be judged, without having the second thought that you might be judged. Having a focus group is, I think, very important. It can be just, it can be consisting of two or three people at the max. Also, it doesn't matter. But those people should be reliable, and you should be able to, like, say your issues openly to them. And um, and and they should help you in finding a solution or gaining confidence to solve the whatever problems you have. um, I think a focus group of that sort is very essential for every single person. Especially, there'll be times when we go through a tough phase in the course, and at that time we have to really get some support, get some encouragement. Of course, our family members are there. We do have our classmates, friends, but a focus group within the university, or it could be even your childhood friends or whoever, like it could be anyone. But yes, I think a focus group is required. It may not be necessary that you talk to them on a daily basis, or weekly basis, monthly basis, or anything of that fixed sort. You can get back to them at any time. It'll be a bouncing board. You can get back to them, share your problems, share your things, and find us and get back with a solution. That should be the main goal out there. So, for those of you who have a focus group, kudos, and for those who don't have, I think you guys have to try finding out, arrange something out. um, Make sure that you find the right people for making your focus group, and they should be your focus group, and it really helps a lot, while especially during the tough phases, during a tough exam, or while preparing for a very big exam of your life. I think these kind of situations or phases would be really eased out if you have a focus group with you. Okay, so moving on to the next problem is stressing out and burning out. I think the demanding nature of a medical education can lead to stress, like frequent, like stress and burnout. Many of us, I've heard from many students in my university and in other universities, the friends I have or the people I've met over the last few years, um, they have complained about burning out, and they feel like, oh man, I'm burned out. And personally, even I have had a phase when I felt that, okay, how long is this going to go? Is this going to be forever? Like, how is it? So, in those times, I really feel like we need to be easy on ourselves. We should not push our limits. We should make strategies, of course, make strategies, not give up on work, of course, not give up on work, but um, say probably do something out of your routine. You must be, I think most of people who have burnt out have either pushed their limits, who they have strained themselves to an extent where now they feel like, okay, I'm done. I feel like I'm just doing this 24 hours a day. So you need to break that routine out, come out of that, put some strategies, put some time, new fresh timetable for yourself where you are doing minimal of what you have been doing so far. uh, Things like exercise, and things like hobbies, especially I've personally tried this, doing things or the hobbies which we had in our childhood are one of the things which are like locally favorite things to do. It could be painting, it could be drawing, it could be singing, it could be any such hobby, or cycling for some people, or any kind of sports, which we have not continued, but we have left that somewhere in our teenage or in in our childhood. So I think those hobbies are a great way to relieve our stress by doing that again. Like, some of my friends, I have seen them. just coloring pictures. They print out pictures and they color it, just color, fill colors, and that relieves a lot of stress. So things like that is a great way to relieve your stress. Is a great way to let out all that which you have bottled up, and I think it can relieve your burnout feeling. Of course, for them who go to the gym regularly, who have their daily exercises, and who are doing who are following the timetable, and who are following their, like, meeting their goals, are great. Good job, guys. But the ones who are burning out, who feel burnt out, who feel like this is going to go forever, it's not. You have very less time. We all have very less time, and med school is limited. The life after that is going to be even more longer. It's going to be even more harder. But we are not going to think about that. We're going to think about how successfully we are finishing our course, how successfully we are meeting our expectations. That is most important thing for us. And one thing at a time, guys, one step at a time. So I think that's how we think when we have a burnout. And I think these kind of things would work. And for them who really need counseling, who feel like they need someone to listen out to what they have to say, I think you need your adequate rest and you need your break. Do seek help. Do go and meet a person who you think could give you the best advice. It could be your parents, it could be your family, or some for some it's their childhood friends. For others, it could be a counselor. However it works, whatever works for you, and none of these options are good or bad. All of these options are the go-to options. Whatever works for you is the best option, and at that point of time, and you need to get there. Don't let your burnout really affect your performance or slow you down. Keep working hard, and you will surely see the results. If not soon, later, but you will see the results of it. So moving to the third problem is for especially students. I think the day scholars, it is still better. These issues might not be relatable for them, but for them who for most of us who have been staying out of our home, far away from our home, and who are staying alone and completing their course, for them who have been doing this from the very first year, is a big thing. Like they for by now, like probably by when they reach third year, they are pretty okay with these things because now they have learned the skill and the art to really manage themselves alone, and to deal their problems by themselves. So this is to the first year, second year students who still find it a little hard and who are still having who have had that shaky start and who are coping with these things. So the topic is financial strain for those students who are having a financial stress. I think nowadays with the kind of increasing expenditure, like the kind of inflation going around, I see myself that there are some daily essentials. The prices of that increases every now and then, and it really affects the budget of the month, or it really affects the numbers go off the roof sometimes, and we need to decide on how to, we need to really take some tough calls to really curtail the entire thing within the limit. As students, we all have friends, we all have our plans, parties, and it gets really hard in during those times to have our limited budget, at the same time do all that we want to do. Many a times we have to choose one over the other, but I think the best way to deal with such financial strain, such financial stress, to in order to avoid them, right? I think budgeting them is the best way. Budgeting them, and part-time job for them for who it is feasible. Great, good job, guys. I think it's a really big thing. Dealing with med school, handling all the stress and the long hours which we have, the classes, or mm, the exams which we have. Dealing with that itself is a tough thing. For them who are able to manage that along with the part time is a real, they are the real multitaskers. I think we all need to get inspired from them. We all need to get motivated from them. The kind of motivation you guys have is just great. I think that's a great thing. So for them who are doing part time is great. But apart from that, I think many of us can, first of all, I would say that who borrow money from their friends, who borrow money from others to meet their monthly expenditure. Just like to address them first, I would say that it's a very your friends could be sweet enough to lend you money. Your colleagues or your classmates could be sweet enough or could trust you enough to lend you some money for a certain period of time. But you need to understand that this is a very wrong habit which you're going through, because if you're not able to limit yourself within the budget you have given to yourself or your parents have given you or however, then it means that you're not estimating yourself, your expenditure in the right way. You're not estimating the situation and the expenses, or curtailing yourself within the limits. It's not really like a crime or something, but I think in order to get into the right practice, I think the best thing would be to avoid borrowing and lending money, right? uh, so many of us, we think that okay, I have lent him money before, or I've lent her money before, I can borrow as well when I need, right? We are friends for a reason, so of course. But I think that in a longer run, in a longer period of time, becomes like a habit to us, where we take our budgets for granted. So lending money will actually, we lose the judgment, right? So to them, I would say first thing is avoid lending money. Like first thing is that should not be the option in your head itself, because many times I've seen this, that people like students, they do unwanted expenses. They have some unwanted expenses. They spend their money without thinking twice, like mindlessly spending money somewhere, and then later towards the end of the month, they end up lending money with no realization that they have mindlessly spent their money somewhere. So in order to get that realization first, you need to stop lending money, and then you'll know the tough part about it. Another thing is coming back to every one of us, where we need to budget ourselves, limit ourselves, and at the same time find the best way to purchase a thing. For example, if you have to buy stationeries for your uh, monthly, making notes, or having your study material or whatever, if you have to print some stuff, if you have to purchase some stationeries, find the best place to do that. Where is the best price? Where can we get the best things for the best price? Curtailing and sacrificing on some things which we have been having or we've been getting so far, is again a great option as well, because that's not going to limit you into anything. Like for example, if a spiral book is expensive, or if a manuscript book is expensive, then going for an alternative one, things like that could be done. At the same time, planning your thing. If you have a limited budget, if you can't purchase something this month, purchase it the next month, rather than purchasing it now, just because of so and so reason. There's a good sale offer, etc. I think planning it out. Okay, we might have Christmas coming up, we might have Easter coming up. Let's wait for that, right? Let's buy it at that time. So planning that, when you do that, automatically I think most of us would start saving money at the same time, for meeting our requirements, right? So I'm sure you guys also have would have such great ideas on saving some money, or planning out our finances. I would really appreciate if a few of you could comment down on this video, on how to manage our finances. For me as well personally, I feel like I know a few way to manage my finances, but I'm a little extreme onto it. Like either I save money or I spend money. There isn't a midway to it. So I keep saving it to a point, and then I feel like okay, now I think I really need to get some things like it's a necessity. So let's spend. And when I go to spend, it's again extreme. Like I end up spending like 60-70% of what I've saved. So it like all those efforts go in vain, right? So that budgeting is very important, right? And I think if our viewers, you all can comment down on one thing which has best worked for you, or one thing which has saved your life as well, like probably that one method or one tip by which you saved a few hundreds, and it has come, it has been the best decision of your life, and it has been very useful and helpful for you at a very crucial period or time. One such incident or one such tip to save money, I think you can comment down below, and it would really be great. um, Many of us can implement it in our lives. um, Going to the next one is next issue is competitive academic environment in med school. Most of us have students who are really really studious. We have all had that one classmate, we have all had that one friend who is very competitive. I think a healthy competition is always welcome. All of us have no issues with healthy competitions, but sometimes things can get a little um, things can go a little off track, or they can get ugly, right? When you start wishing that you should get more than someone. Guys, we are our only competitors. I think there is a huge competition outside. I totally believe in that. It's a very competitive field and we need to be better. But comparing ourselves uh, with someone else's growth is not the right way, because we all have not started on the same level, right? All of us have come from different places, from different knowledge sides, different academic boards, etc. So I think the best way to you know deal with this issue of competition is personal growth. Focus on personal growth. Have individual targets for yourselves. Look at yourself a year before, 6 months before, and now. How much you have been getting in the last semester? How much are you getting this semester? How have you been doing last year, and how are you doing this year? I think comparing your scores would be the best way. Comparing yourself with your previous self would be the best way to deal with such things. For those who are in the clinical years, I think we all have been having you know rotations which are repeating every year. So look at your grades or GPAs or however it works in your universities, like percentage in the previous year, in the previous semester to this semester. If you've got, say, a 3.515 in the previous semester for for some rotation, make sure that you get more than that in the coming semester or in this semester. So I think that's the best way to look at and feel happy also, because many times when we compare, we end up being very dissatisfied. We end up being very um, we don't realize the fact that we have actually improved a lot, but just because we are comparing, we don't get that encouragement, we don't get that self satisfaction or the gratification which we seek for, and that can also lead to burnouts many a times, right? So we need to focus on personal growth. We need to look at ourselves, and we are the best competitors of ourselves. We are the only competition to ourselves. No one else is a competition to us, because in comparison we can compare 100 people who are better than us, 100 people who are not up to our level, or the place where we are, right? But that's not going to really satisfy anything, or it's not going to meet any purpose. The best way is you are the best competitor for yourself. Focus on your personal growth, focus on individual targets, and seek academic support, ask for tutoring, sit in study groups, but don't ever have this feeling that okay, he's able to learn faster than me, or she's get like getting this so quickly and so easily. Why am I not? Focus on how you were in your high school and how you are right now. Right? We all have improved. We all have grown. That's for sure. Otherwise, we are not. We wouldn't be in the place where we are today. Right? So I think such things really matter, and uh, I think that kind of an approach will take us longer, take us further, and avoid things like burnouts. Because when you compare, we might have a lot of feelings and a different mindset which develops within us, because of which we end up sometimes not realizing that we have limited our growth. We are not appreciating our efforts. And when we stop appreciating our efforts, we are less happy, right? We are more dissatisfied, and that affects our performance to a great extent. That not just affects our performance, but also our efficiency to learn. We then forget that we are learning for knowledge, we're not learning for the grades or the scores, right? I think one of the most important things is that having a balanced perspective on grades and prioritizing and understanding over memorization is also important. A lot of students who keep memorizing a lot of content and knowledge just to get a good score in the exam, but not to really understand what they are doing. To avoid such situations, I think the best way to go about is self self growth or individual looking at yourself, looking at the individual track record of how you were and how you are doing, right? Before and now, and how you would want to see your graph going up, right? You look at the projectile of how you're going, where you're going. If it's positive growth, then it is a best thing. If it's stagnant, if it's the same, then you need to know that there's some place you need to change your strategies of learning. Only then you can push that stagnant graph into a positive one, and to a higher side. And if suppose it's going down, then an overview or an insight on that is required. You need to introspect into yourself of what have you been doing wrong all this while for your personal uh, performance, academic scores, grades going down. What is the reason? It could be some habit, it could be some change in the routine, it could be it could be a new friend, or it could be a it could be a change in the routine basically, which could cause that. And as I said, like things like a vacation after coming back from it, you have not felt like studying itself. You have not felt like getting back to the table, and you're or probably not able to concentrate enough. So these kind of things are very common and usually happens to most of us. But having the right mind, thinking about it, and getting back on track is the only way out of this entire situation. So when that's the final ultimate thing, we need to work towards it, and there should be no other thought, no other way out to it. So coming to the next thing is managing personal relationships. I think many of us have you know time constraints, stress, mm, panic attacks. Within the 5 6 years of our course, or for them who have 4 year courses, we within the course duration time, and we have had these kind of things. We have had situations where there's a time constraint. We need to submit. We have an assignment to submit. We have an exam coming up. We might have a lot of things. We might have a research issues which is going on, and a conference to attend over the weekend. A lot of things. Sometimes most of us have had 6 days a week of going to university, and probably just the Sundays off. But managing our personal relation is as important. I think having the friends who you have been having before your high school and even now, the friends you made before high school, right? If they're still the same with you today, if they are still if you guys still talk the same way. I think I think you guys have really balanced and managed your things well, because I've seen so many of them before high school, complete different person, now complete different person, and the only reason for that is not able to manage and maintain their uh, balanced lifestyle. If they're not able to maintain their balanced lifestyle, many of them have had a lot of issues like mental health issues. Their mental health has gone down, and and they really need support and help, which they realized at a very later point in time. So it's very important for us to focus on that thing, managing our personal relations, whatever it is. We need to make sure that we are allocating time, quality time for our relationships, right? It could even be family time. Family time also is as important as any other personal relationship. So we need to make sure that we are spending enough time with every person. Of course, putting them all aside, taking them for granted when you really need to focus on what is important is, of course, very, very important, and the best thing, because you can't think about everything all the time. So when you have exams, focusing on the exams, doing that is important. But at the same time, it's as important to remember that they have waited for you when you have been preparing for your exams, when you have been giving your exams. They have waited for you all this while. So it's very important for us to keep in mind, once we are done with this entire phase of examination, we need to get back to them. Or this entire stressful phase of our life, we need to get back to them. So getting back is our responsibility, and giving our space is their responsibility. I think both go hand in hand. So when they give you that space to work independently, to they let you have your time and get your work done. It's as important for us as also to have that accountability to get back to them, spend some quality time with them, and and that's the way we thank them. We reciprocate our part of maintaining the relationship, or the respect which we give them, right? So all our family and friends, classmates, the high school friends, childhood friends, um, are yeah. So I think all of them really understand that in medical education, it demands a lot from an individual, and whatever we are, I think we are because of them. We are because of our family. We are who we are, and we are where we are because of them, right? Our parents, our family, and right, and our friends who have supported us. So it's very important to spend time with them. It's very important to get back to them, especially for them who have left, who stay far from their home, far from their country, and were studying international students. I think for us, it's like it's a shorter period of time. It's a very small window which you get every year, probably a month or two at the max, to really spend with our family and friends, with our childhood friends, to meet them back. It's like a reunion. It's like the cousins. So I think all of us have to really forget at that time. Just don't carry your stress. Just don't carry uh, all that which is going on in your personal space, in your personal life. Don't take carry that with them, or carry that when you're with them. I know it's kind of hard, but try to forget it. Try to keep it aside when you're with them. Just when you're with them, because we have the rest 10 months, 9 months, 10 months of our lives to get back to those things, deal with those things. So I think that's the best way, according to me. I would strongly suggest you guys to also put up something in the comments on this note, regarding how exactly do you manage when you go for vacation. Do you really carry what's going on in the university, or that one fight which you had with one classmate, or the argument which you had with one good friend of yours back in the country when you're studying? You know, do you take that with you? Because for me, I personally feel like whenever I go back home, whenever I get back home, it's a timeless feeling. I feel like I have never gone out of house. I forget everything which has happened outside the my home country, outside my home. I forget all that which has happened when I'm with them. And I really don't think about those things. Maybe a few instances, like, how it was back there and how it is right now. Maybe like a few movements, few minutes. But apart from that, I don't carry the problems or the positives or negatives of that place to home. So home should always be a home, or like whenever you're with your friends, yeah, I think you should make new memories out there than carrying the good and bad ones from where what you have been living. So I think having that two worlds separate apart is a good thing, according to me. What do you guys think about this? Please do let us know about that, and we really uh, looking forward for your comments on that. And coming to the next thing, next topic is clinical skill development, which is transitioning from the theoretical knowledge to the practical skills. Many of us have had clinical rotations starting from the fourth year of medical school, right? Um, for MBBS, MD students in particular, we've had active participation in the clinical rotations from the fourth year onwards. I think it's very important for us to understand that when we are in our preclinical phase, it has been very different. We sit in the lecture halls, the seminar halls, and there's been lecture going on. The professors sometimes, some of them ask questions, some professors don't ask questions, some doctors are particular about participation of the students. Some of them encourage questions, some of them don't really give you a good response to the kind of questions you have. That's all about it. A lot depends on your personal knowledge and your individual studying method, how you learn your stuff. And once you learn your stuff, you're good to go. You can give the exam and you clear that module and you go for the next system. Once you're done with all the systems, you're done with the preclinical phase. But when you come to the clinical side, like when we start with our clinical, rotations, I think it's very important to realize that over here, speaking with every person, like our communication skills plays a very big role. The way we communicate with people, sometimes many patients can't understand what we speak, how we speak. Maybe a little more slow. We need to slow ourselves when we speak. We need to be more clear. We need to be more loud. Many of us have, I think, faced this. I think it's pretty relatable. For those who find this relatable or who have had this kind of difficulties, can please comment down on what was your first expectation versus reality kind of a scenario when you go to the hospital. I think most of us felt very confident after our preclinical exams that okay, uh, I've got a great score and I'm gonna do great in the hospital probably. Some of us were nervous, some of us were underconfident, or we were just underplaying ourselves. But when we go to the clinical rotations, very different scenario out there. So first thing is on that is communication skill. Second thing is the feedback. I think asking doctors at the end of the rotation, on the last day of the rotation, on how did they really look at you as. This is not from a academic like grades perspective thing, not to really improve your grades or to really it is for your interpersonal, uh, developing yourself as your personality, your interpersonal skills, your communication skills. It's for that. Overall, as a future doctor, how you look at yourself. So asking them feedback is very important, I feel, on have you participated enough, um, what are the areas where you have to improve or you have to focus on. Many times you might think that the doctors who we are rotating with are rotating with like some 50 other students, 40 other students, or five other groups, six other groups. Doesn't matter. I think most of our doctors are so sharp and so smart that they really have something to say about you. They are just waiting for you to get to them. And when you go to them and you say that you ask them, you seek that help, you seek that feedback, they are giving it to you right there, and it really helps. Personally, I've experienced it. I've asked few doctors at the end of my rotation about how my rotation was, what are areas to improve, what can I do to uh, you know many times they have said some points where I never expected them to say that, but it might be true from their end. They see that shortcoming in me, and I think that's how we realize new weaknesses, new challenges. We have to improve ourselves in that, right? So it's very important for us to you know seek feedback from our doctors who we have been rotating with. No matter how long your rotation has been, it could be a week, it could be 2 weeks, it could be 3 weeks, or it could be more than 4 weeks. Doesn't matter. No matter how long your rotation is, always seek feedback from the doctors who you have rotated with, in whichever departments, irrespective of whether you like the department or don't like the department. I think feedback from the doctors is very important and crucial for us to improve, right? And practicing skills. It could be in the sim lab or it could be in the hospital with the patients. Sometimes we might not really have a very conducive environment. We might not really have a. It's a hospital. Many people are facing many things. Sometimes the patients are in pain. We have to, I think, push ourselves on this aspect of going forward and practicing our skills. No, sometimes we might have a few groups of students from different courses coming along together. So we might be a bunch of say 8 or 10 kids or 12 kids, um, students, okay, together. We might be practicing our examination, or if the doctor asks one of us to perform. I think many a times we might step back, or we might just you know stay there because we feel like all the 10 students who are observing us, when we make a mistake, or when we are corrected, might be a little embarrassing of a situation. I think that thing should go out. Most important, so many of us might be an introvert, but most important thing is we are all there to learn there. Many of us have learned from others' mistakes. Many of us have learned from, uh, you know, many of us have learned a lot from others' strengths and others' mistakes. So we need to also consider that and make sure that whenever you get an opportunity or chance in the groups you are um, in the rotations you are in the departments you are in, or with the doctors you are in, you have a comfortable relation with the doctor. You make sure that you're comfortable with the doctor who is, uh, you know, there with you throughout the rotations, and go ahead and practice all the skills. I think it's a very important aspect when it comes to, because the skills what we have learned in our preclinical years is what we are implementing and applying over here. And if we don't keep practicing it, probably we might, like what we have done theoretically, we might as well forget. But when we are doing it practically, it might stay in our mind, in our head, back of our head, any day, any night if it's required. Mm, Before an exam also, many a times we might not really we wouldn't really need to get back to it, revise it. We can just go and apply it and practice it, because we have been uh, doing it over time for a long duration of long period of time. So um, the more number of times we do, the more better we get at it. At the same time, uh, there's a lesser chance for us to miss out on any such points. Many times after clinical exams, I've faced this thing that I might have messed up that one small step. I might have messed up that one one thing to mention that one thing, or to check for that one thing. I might have examined that area, but I might have missed that one small special test or something of that sort. So I think it's important to keep doing it over and over again, so that we get the things right. Yeah. And moving to the next one is coping with failures. Many of us in med school have had a situation at some point where we have our setbacks, where we have our challenges, and we have got disheartened with the kind of scores and grades we have attained. It could be a particular department rotation. It could be a particular module, or for us, or for few of us, it could be the semester, right? we all have had our bad phase, and considering the fact that medicine is such a long course, the bachelor's is like 5 6 years course. um, I think, and after that we have the internship, and then we have a longer route to, uh, a longer journey to cover. I think it's important for us to understand that failures are something which we cannot avoid, and a very positive mindset, and looking at failures as an opportunity to learn something new or to improve ourselves is something to look into. That perspective, when it comes to dealing with failures, a perspective of positive perspective, a growth mindset is very important. I think we can. There's a lot of content about growth mindset in YouTube as well, where people specifically talk about growth mindset, like about 6 minutes, 10 minutes, about what exactly growth mindset is all about, and what should be our perspective about it. So I think having that is very very important when it comes to med school. All the medical students, maybe not just MD program students, but all the courses should really have that, because when we meet with a failure, especially for them who have been scoring really good and high, like maybe you're the best in the class. uh, I think for those kind of students it gets even more tough and hard, because they have met with failures, they have faced failures less number of times. For those of us who have been uh, average students or above average students, uh, we have probably seen it more number of times, like a failure or unexpected results, more number of times. So I think that's a little, like we have had that days, we have had that situations, we have faced it. Many times this kind of stress comes because of peer pressure, or a competitive nature. Sometimes it comes because of our families. So I would say families or relatives or cousins or whoever we comparing ourselves with. So I think comparison again is a very, uh, it is a necessary evil, but at the same time, uh, when to have it and when to cut it off, when to focus on your individual growth, personal growth, and looking at yourself, like comparing yourself with just previous you or you in the past is the best way to go about coping with any failure. And of course, whenever we have a failure, as I said before, it should be an opportunity to, uh, you know it should be an opportunity to, you know uh, get back harder, get back and improve ourselves in such a way that we do even better than, a new best of us is out there. And of course seeking guidance from faculty or mentors, and academic support from the university and from our peers or friends is the best way. Having steady strategies. I think many a times we've had failures because of our failure of our, not failure of us or not putting enough hard work, but sometimes because of the strategies which we have been following is not really working out, especially students who have transitioned from the preclinical year to the clinical year, the fourth year, third year, fourth year. Students usually have this kind of an issue. Many times, those are students who really complain about not doing so well, not doing up to the mark, like have been doing great previously, but not doing up to the mark now, who are dissatisfied with their own results. I think being dissatisfied for a longer period of time also, affects our mental health. So every time you give an exam, you're dissatisfied with the result, you're dissatisfied, and it reduces your efficiency into, um, the perspective in which we look at studies becomes different. When it becomes a chronic issue and becomes a longer, when it becomes a daily thing for a longer period of time, it becomes your perspective changes, and it becomes a little difficult for us to get back to our track and be positive. So it's very important to timely keep introspecting ourselves, timely keep making ourselves positive, looking into a positive aspect of things, learning to look at the positive aspect of things, um, and focusing on the positives than the negatives improving on the positives and also coping with the negatives, like reducing and minimaling the negative aspects. I think is the best way to cope with failures. And end of the day, I think you have set your goals, so you can attain it. You should attain it, and you will attain it. And always, your previous experiences are the best motivating factors. Previous you, uh, we all have our journey to where we have reached today. And looking back at, I think failure is the time when you look back at things and get motivated. The previous failures, the previous challenges you have dealt with, I think that's the best way to get yourself motivated and going forward, facing the challenges and the hurdles you have had in the present time. Okay, then moving to the next and the last topic, which is also more like a continuation from what we have been speaking, is maintaining motivation. Many students feel like they're not able to sustain the motivation throughout the rigorous years, and I think the best way is to set achievable goals. To deal with that is achievable goals and celebrate even the smallest things. Many times we don't appreciate ourselves when we get some good scores, or we might be like, oh, this was an easy module. Probably like the entire class has also got the great score. So it doesn't really matter if I got a 90% in this. It's okay. It's a very easy module, but I think celebrating that also is important, because every small or big thing requires efforts. Nothing comes easy. So um, celebrating things like that. Celebrating doesn't mean we go and party hard for next week or 10 days. Probably just appreciate ourselves, motivate. It becomes a motivating factor to put more efforts in the upcoming time, or probably like self care, or shopping, or having good food. These things also come under, or probably going for a movie or whatever, or hanging out with friends. However, is your way out, whatever you prefer doing. I think you could do that. And yeah, I think pursuing medicine is a big thing, personally speaking, because it's the number of years what we are going through is something which very few students have to go through this path, and it's very, I think, specific for us. So I think a pat on our back for that itself, and stay motivated and work harder, guys, and keep your plans, set your goals. Um, if you're already doing great in what you're doing, set your goals for the next, like what next. Think about that and the next step, right? Think about that and focus on that. If you are being not doing so well in the previous year or so far, think about how to make the next year your best year in medicine, the best year in medicine. Think about that. So I think various options are there. All right, you can look into it and look into the career implications, how a particular year or a particular semester not going so well can have an implication in your career, right? And I think the kind of impact and the implication it might have would also motivate us sometimes to do better. And I think encouragement and support is the most important thing when it comes to medicine. All of us need the required encouragement and, of course, support. Support doesn't just mean support during a time when you are facing trouble, you are having an issue. Support also means, a consistent encouragement, a consistent, you know, a person that will always be there, a 2 a.m. friend, or your family members or parents, and have positive people around you, because I think that creates a huge difference in your life, because we all, in like when we get busy in our lives, we don't care about the world, what's happening out in the world. When we have had that 14, 15 days of preparation, and once the exam is over, after the 2 weeks, we really don't know what has happened in the last 2 weeks, right? So having a positive circle among around us, when we have such people among us, we usually end up being positive, looking things in a positive lens is a great way to lead life, to pursue the course we are doing, and to face the challenges we might have. And like, we might end up, sailing through all these hardships with a big broad smile on our face, at the same time clearing all our exams with flying colors, if we have a really positive circle around us. So try to maintain a positive circle. That's also an effort and step we need to take for a better time, and for a positive improvement within us, right? So, speaking about that, anything which has really touched you, or which you could connect to, any one point, one line, even one line in this entire podcast, if it has really touched you, or if you feel like, okay, this is great, then comment down below, and do share it with your friends who you feel need it. And I think many of these things are particularly for medical students, but some of these things could also be for uh, people from other courses as well. Any international student might require or need such a advice, or I think point to be noted, right? If you think anything of that sort is there, then please do share it with the friends. And as I said, a big thanks and shout out to Eddie again for starting this entire thing and calling me in. And I think that's it for today. We'll soon get back with a new topic and all new guest for you people, right? Thank you guys.